when people are depressed, it's difficult for them to see past the moment they're in and how troubling it is. But I want to give you reason to have great joy, because depression is not something that you need to be stuck with. Some people have depression that is exquisitely responsive to nutritional support. I've been practicing medicine and doing a lot of psych and counseling for 20 or 30 years now. And I have found that most patients will do dramatically better with nutritional support, whether or not they get off their medication, whether or not they ever needed it in the first place. I'm not really concerned about that as much as you knowing clearly what nutrition can help you with depression. Number one, you need to eat well. You can't eat sugar. Sugar makes you depressed. Sugar will give you high and then a really bad low. So needless to say, sugar is a bad deal. Depressing. There's a book called Sugar Blues, if you'd ever like to look at it. It's kind of interesting. Magnesium, of course, in everybody. It improves receptor function in the brain for reception of serotonin. That's why people get drugs like Zoloft or Prozac or Effexor, is to improve serotonin function. Well, if you can do it with magnesium, why not do it that way? It's pretty simple. So think about all the medications that are out there and think about how much more it would make sense to do the nutritional thing that supports what the medication would do. Frequently, I'll check people's medication history and make a decision based on their response, good response to those medications, which nutrition support would do best. St. John's wort. St. John's wort acts just like a Prozac type drug or Zoloft type drug in that it improves serotonin. It is the #1 drug, quote unquote, for depression in Europe. So think about St. John's wort, a capsule or two twice a day. It's got to be really fresh, no older than 6 months old. So make sure it's from a good source and you may get some really good response to that. There are other nutrients that are specific and very effective in depression because they support neurotransmission. And I'll give you those specific ones in just a sec.